Welcome back to my channel. Today, I'm excited to share some groundbreaking research that sheds light on the spread of COVID-19 variants, particularly in rural areas. Conducted by the University of Missouri School of Medicine in collaboration with the NextGen Center for Influenza and Emerging Infectious Diseases, this study reveals crucial insights into how the monitoring of COVID-19 primarily focused on urban centers, leaving rural communities somewhat neglected. As a result, variants of the virus were quietly evolving in these less monitored areas. The research highlights the rapid evolution of SARS-CoV-2, the virus responsible for COVID-19, which demonstrated a concerning ability to mutate into more transmissible variants. Study author Henry Wan noted that many of these variants were circulating in rural Missouri during the early stages of the pandemic, indicating that by the time they were identified in urban areas, they had likely already spread widely across the country and even globally. This suggests a significant gap in our understanding of how the virus was evolving in less populated regions. The study found that at least 7 unique variants were detected in rural Missouri, with 4 of these variants later appearing in samples from other countries. This underscores the critical need for increased surveillance in rural populations, as these areas can serve as breeding grounds for new variants. By monitoring these communities more effectively, public health officials can identify and respond to emerging variants before they escalate into widespread outbreaks. Henry Wan emphasized the importance of adapting disease monitoring strategies to include rural populations. He believes that understanding how emerging disease variants evolve and spread, particularly in non-urban settings, is vital for creating timely and effective public health interventions. This is not only crucial for COVID-19 but also for other infectious diseases that can similarly evolve in unique ways. In addition to tracking the evolution of variants, the research team developed predictive models to assess the likelihood of severe outcomes for patients diagnosed with COVID-19. These models consider various risk factors, such as immunosuppression, acute respiratory distress, cardiovascular disease, age, and residency in rural areas. By identifying at-risk patients early, healthcare providers can implement timely interventions that may prevent serious health declines, hospitalization, or even death. The findings also reinforce existing knowledge about COVID-19 risk factors, particularly the vulnerabilities faced by rural populations. The study titled Rural Populations Facilitated Early SARS-CoV-2 Evolution and Transmission in Missouri, USA was published in the journal NPJ Viruses and highlights the collaborative efforts of a multidisciplinary research team, including professionals from the University of Missouri, the Walter Reed Army Institute of Research, and St. Jude Children's Research Hospital. Moreover, a related study, Prediction Models for COVID-19 Disease Outcomes, was also published recently, further contributing to our understanding of the virus and its impact on various populations. The research has significant implications for future pandemic preparedness and response, stressing the need for comprehensive monitoring strategies that encompass all communities, urban and rural alike. As COVID-19 cases continue to rise and new variants emerge, this research serves as a vital reminder of the interconnectedness of our public health strategies. By addressing gaps in surveillance and tailoring interventions to meet the needs of different populations, we can improve outcomes for those most at risk and better prepare for future infectious disease challenges.